Hello, my name is Tyler Carley. I'm currently enrolled at Jefferson State Community College in the Physical Therapy Assistance Program. Today we're going to be talking about ventriculoperitoneal shunts, also known as VP shunts. I just want to touch base, I chose this topic because I've seen a VP shunt twice, and it was at my first clinical. I thought it was pretty neat. I wanted to learn more about it, so I did some more research. And then also I have a friend that just had a baby, and so her child has been in for surgery to get a VP shunt placed. Okay, let's start with what is a VP shunt. A VP shunt is placed in the ventricles of the brain, and there's a hollow tube that goes all the way down to the abdomen. As I have here, I have the picture where it is in the brain, and then the hollow tube is placed and it drains down to the abdomen, specifically the peritoneal cavity. Alright, let's get down to what a VP shunt does. Typically, VP shunts are placed to treat a condition called hydrocephalus, which is excessive fluid on the brain. It's a medical device that relieves the pressure on the brain caused by the fluid accumulated. And that fluid is cerebrospinal fluid. Whenever a child has hydrocephalus, it's the accumulation of the cerebrospinal fluid, which creates a lot of pressure on the brain as a whole. It's most common, it's mostly used for children before they're 2 years old. So these surgeries happen right around, typically before the age of 2, just to treat the hydrocephalus. And sometimes later in life they do have to be replaced. It is rare that it does have to be replaced, but it is possible. In my case, when I was in clinicals, it was a 50-year-old patient that had to have theirs replaced. Alright, let's talk about how the shunt is actually placed within your brain. So what they do the surgical procedure and they go through the meninges. And then they find the ventricles and they go and insert the hollow tube through those ventricles. And then that hollow tube distends down, so it's like in your head, then it distends down all the way into your peritoneal cavity. And so due to gravity and the decreased pressure in your abdomen, that's how it drains the fluid from your brain. And once it reaches down into your abdomen, it is for your body typically absorbs it. And like I said, when there's excessive CSF fluid on the brain, it causes the intracranial pressure. Most of the time before they do these surgeries, they insert an ICP monitor just to see what the pressure is. And the pressure results in loss of balance and other neurological issues, and this is where therapy comes into play. With balance issues, the equilibrium is displaced and it's typically off. Alright, indications for therapy: balance loss, gait training, pacing techniques, and functional activities. I mainly focused on the older population, whenever it has to be replaced, just because that's what I've seen in clinics. So whenever it gets replaced, you go from excessive amounts of fluid to the fluid actually draining down, and that creates the balance issues. They're not used to it. Your body accommodates for the fluid being on the brain, and once it starts draining, you can feel dizzy, your gait can be uneven. Pacing techniques is good just because they run out of energy or they get dizzy so fast they must sit down. I like the feeling of fainting. Also, it's good to do functional activities. For example, if their everyday life, they walk dogs, for example, instead of just gait training, and that's all you would do in therapy, you would advance up to something similar to like walking a dog, having a weight attached to a rope or some type of string or resistance band, and have them like pull or push. And when we talk about physical therapy, it should be weaned, the patient should be weaned off. You should never cut physical therapy cold turkey. Whenever you are encountering a patient that does have a VP shunt, just because their body gets used to therapy a certain amount of times a day. For example, if you go 4 days a week, you shouldn't just be slap off of therapy. You should wean down to 3 days to 2 days, and then possibly just 1 day a week, and then have the PT do the evaluations. This is just because, once again, their body gets so used to doing an activity that if you cut cold turkey, they could take steps back. And then I have my works cited listed here, but I just thought it was really neat how most patients do have these shunts placed when they're 2. And then therapy, as far as therapy goes, not cutting them cold turkey, just weaning them off, because it does have dangerous effects. And the goal of therapy is to get a patient to the optimal functioning level. And so you want your patient to get better, and you want them to just be better so they don't have to keep coming back and having relapses. It's always good to have noted progress and to sustain that progress. And that is all I have for you today. Thank you.